Research is integral to what we do. If we are to continue to be the cutting-edge academic medical center for the state of Arkansas, we not only have to provide great care and education, but we have to be thinking about how we can do things better.
Last year, we reached a very high mark. We have $158 million of funding from outside our state. And that dollar amount represents 3 consecutive years of double-digit growth that brings us up over 85% above the level of 2019.
Our trials have really grown dramatically. Last year we had over 1,600 individuals enrolled in clinical trials around our state, and the thing I'm really proud of is that enrollment really reflects the population of Arkansas.
Painful diabetic neuropathy is not something I ever thought I would research as a neurosurgeon, but it turns out that it is one of the biggest areas of impact that we've been able to have with the research we lead here at UAMS. We've identified that using a specific stimulator, we can decrease pain by 80% because of pain improvements, but we may be able to stop what diabetes does to their nerve function and the damage that continues.
Let me just summarize where we are for the progress to NCI designation. I've been here about 3 years now. We've hired 24 lab-based researchers. They're occupying 31,000 square feet of lab space, so it's really been a massive expansion. It's going to help our research base. We've reorganized the entire clinical trial operation, which now sits within the Cancer Institute.
As of about 2 years ago, we have launched what's referred to as the National Institutes of Health National Resource for Quantitative Proteomics. And this is the first national resource funded by the NIH in Arkansas and in this region of the country ever. Over 75% of the states in the United States utilize this service, and I always tell people this is the largest resource of its type between Boston and San Diego. Biomedical informatics is a large strength on this campus, so our ability to take complex data sets and understand them in such a way to deliver what's called personalized medicine.
The Cancer Patient Navigation Program is intended to reduce the cancer burden across the state of Arkansas. My team has visited over 900 federally qualified healthcare clinics, community-based organizations, faith-based organizations, and other businesses to talk about who we are and what we do so that people across the state of Arkansas are aware of our program.
One of our really exciting announcements over the last couple of months has been the establishment of the first adult neurofibromatosis clinic in the nation. And the reason why this is important is that neurofibromatosis is usually diagnosed in children. They get very, very good care at the Children's Hospital, but once they get to 18, they're no longer children. So they have to switch their care. Neurofibromatosis clinic is going to take care of that.
We have many states that do not have a center that treats those diseases. I have patients from Missouri, I have patients even from Texas. So increasing the care and increasing the importance of Arkansas nationally.
Clinical trials benefit Arkansans in many ways. Clinical trials are basically the mechanism in the United States for how we get new drugs on the market, how we develop new drugs to treat conditions that may not have been treatable before. One of the things I'm most proud of about our CTSA is how we're taking research out of Little Rock and extending it out into the state. And we're doing that by working through our regional program sites and through something we call the Rural Research Network. And this is important because it gives people across the state increased opportunities to participate in research, making sure that our research is relevant to Arkansans.
The neural-enabled prosthesis trial is a really unique trial for us because it's a medical device that was developed by a faculty member and her team at the University of Arkansas. The device was implanted here at UAMS.
You think about somebody who's lost their hand and is using a prosthesis. Those can be powered by muscles to open and close, but without watching the hand open and close, you don't actually know if you're going to hold the styrofoam cup or crush it. And so the team at Fayetteville has developed sensors within the fingertips of the prosthesis that can give the feedback that we don't even think about for those of us who use our hand instead of a prosthesis. This is a first opportunity where we here at UAMS have partnered with the science researchers at the University of Arkansas in Fayetteville to do translational first new innovations for people who need technology to help improve quality of life.
My research in falls prevention is to integrate the Centers for Disease Control Falls Prevention Initiative into outpatient therapy. And unfortunately, 1 in 3 older adults falls each year, and falls is the leading cause of injury death among older adults and a very large cause of disability and loss of independence. So my goal is to have falls prevention be a standard of care in outpatient rehab regardless of the reason that people are attending.
The economic impact of research is very stunning. For every dollars that we bring in for research, there is a multiplier. And the multiplier could be anywhere between $5 to $7. That means we will increase our local economy. In that sense, we will bring up the wages here, we will create new technologies, new industries, and also attracting some new talents.
The future of research is bright. We have so much momentum right now. Our research funding is increasing almost exponentially. So I'm looking forward to seeing where we are 5 years from now. The people that have been treated better because of the work that we've done, the discoveries that we made, the new companies that we've started up. The future's bright.